Good morning, everyone. This is Mark Chibahusky with MCZ Align, and this is Align Health Insights podcast episode number 6. And today we're thrilled to welcome Wang, founder, chairman, and principal analyst of Constellation Research, City of Cupertino council member, best-selling author of Disrupting Digital Business and Everybody Wants to Rule the World, Ray's a frequent guest on Fox Business News and BBC, offering insights on AI, digital transformation, and future trends. Nice to meet you, Ray. Really excited to get into it.
Hey, it's awesome. Thanks for having me here. And it's been quite a long time. It's a lot to catch up on.
Lot to catch up on. Look, I think one of the first questions I want to ask about is just if you could share with my audience a bit about your journey from healthcare to tech consulting to founding Constellation Research and how your experience shapes your views on healthcare innovation today.
Well, I grew up in an immigrant family. Immigrant parents really wanted you to be either, a doctor or an engineer. So I ended up in one of these 6-year med programs and realized I didn't want to be a doctor. And I was like, oh, oops.
Yeah.
And so I transferred out of a 6-year med program, ended up at Johns Hopkins. And it turned out the classes I really liked still had a healthcare bent, but they weren't necessarily in the undergraduate programs. They were actually at the public health school. And so we found a way. There's 4 of us that actually ended up being the first 4 graduates of the undergraduate public health program at
No
Johns
kidding.
Hopkins. And so now it's the biggest major there. And
Wow.
why I was there, I got a chance to work in the hospital, and I realized the things I really enjoyed were actually management consulting projects. And so I got a chance to work on management consulting. That led to getting me to a healthcare fellowship in Detroit, and that led to going to Deloitte in consulting, EY in consulting, and that's how I got into all the healthcare consulting pieces. And really, that. And then, of course, after that, I ended up in the Silicon Valley doing things like product management and, of course, looking at tech research. And so understanding the healthcare business, understanding where technology trends are headed, those are the 2 things that I've been working on for quite a long time. And that really helps me understand why or why not healthcare innovation actually gets adopted, right? And why it's so hard, especially when you're dealing with human lives. I think that's the big difference. It's human lives, and the people in the industry really care about the impact on what it means to human life.
I totally agree with that. Given your focus on business transformation, what skills do you think startups should prioritize when building resilient teams to adopt the AI and other disruptive technologies?
Yeah, so in startups, it's a little bit different, right? You're basically looking for very resilient people to begin with. One day you're copying paper, the next day you're trying to make sure that the logistics for your wireless network actually work. You're actually coding something, to you're meeting with a partner, or you're signing a deal with a client, right? You have very resilient teams in the very beginning. And that's the startup culture. You're working for an amazing idea, an amazing founder. But then when you get the first product out, that's very different. Now you're trying to scale the product. And at that point, you're looking for people that can think about roadmaps, that can get requirements, that can do it on a consistent basis. You're operationalizing. Once you get that done, then you're thinking about markets. Oh, we went into healthcare. Now we're going to go into retail. Now we're going to do something else. And then the next level is like you're trying to get companies that can scale out business ideas. And so with each group, you have a very different type of leadership style, a very different type of team. And so when it comes to doing that in AI at the startup level, I think you need people that are AI natives, people who are able to do it at the beginning.
Interesting take. Reflecting on past tech disruptions, right? I love this question, right? So what's one healthcare innovation that didn't deliver as expected? Right.
EMRs.
And as an aside, I was thinking about this, and what I want to talk about a little bit is the AI scribe madness that's going on right now. Because as it could be a perceived strength, it also could be the perceived weakest link in the chain,
No, they're both related. You put the most valuable person into a data entry road. It's like the most ridiculous thing you could do, right? And so with the passage of these EMRs, you got doctors putting this stuff in. This should be ambient experiences. You should waive the right to be recorded. And sitting in the patient room, those 15 minutes should be, and I wrote this paper for Harvard Business Review. It was like what it would be like to walk into an AI-enabled hospital. This is like 6-7 years ago. The point being, thing is like that conversation should be transcribed, distilled, summarized with action items that the physician then works on. So those 15 minutes become a very useful 15 minutes instead of you have a conversation, nobody has any context, there's no kind of experience on the back end. And then doctors are spending their home time typing everything away. Like that is the most ridiculous thing. So these EMRs have not functioned in the way that they want to.
No.
And they were supposed to be open and interoperable. And what we've done is
Yes.
we've allowed a few vendors to close those off and get away with murder.
Yeah. It sounds a lot like Project Sequoia. Anyway, so I've been spending time in the interoperability space for a while.
Well, I'm judging the
So
HL7 awards. So,
are you really?
oh, yeah, yeah, yeah.
Oh my goodness, that's pretty cool. Look, as a keynote speaker, right? What's the most common question you get from healthcare leaders about AI, and how do you address it?
Well, I think everybody's asking, the most important question is who do you sue when something goes wrong? And that's
Yes.
really about thinking about the chain, right? So, for example, is it you got the software right and a billing error occurred? Well, that's a different problem. You got the software wrong and you've got a error in terms of a patient death, right? That's a huge
Yeah.
issue, right? And so the number one question you have to ask is, who do you sue when something goes wrong? Because if you answer that question, then you're able to figure out the entire chain, who's responsible, what controls are put in place, what level of governance you need, and more importantly, do you have the right people? And the second question, this is related to it, is when and where do you insert a human in the process? It's not about
Yeah.
automation. We can assume it's going to be automation, but when and where you put a human in the process dictates almost everything. Is it regulatory compliance? Is it because you need
Yeah.
extra human intervention? Is it because you're not
Yeah.
confident about the decision automation on the back end?
Yeah. I mean, like in care delivery, right? A lot of that liability falls on the doc, right? Who's not responsible even for the
No,
generation of
no,
the
it's the
algorithm.
AI, man. It's the programming. It wasn't me. Not me. Not me. It's all AI.
Oh my God, you got a great sense of humor. Based on your research, what new roles or skill sets will emerge in healthcare tech by 2027, and how do you think recruiters like myself should prepare for that?
Well, I think you're going to see a lot of what we call vibe coding by the physician or vibe coding by the patient or
Interesting.
by the nurse or vibe coding by the front line healthcare worker to get the functionality they need. So the last mile is going to be super important. And so what you're looking for is people who have really good experience in care pathways, in treatment protocols, so that they can imagine what the most efficient way to deliver for patient experience and also for the employee experience. The worker experience is going to be so important because you've got to figure out, how to make things easier for folks, where to automate, where to actually bring data sets into play. And so I think that's going to be an important piece for healthcare tech.
And one of the most obvious things I'm thinking in my mind is like the relationship that doctors are going to have with technology is almost going to be a prerequisite. Then, no?
It is definitely. I mean, just as much
Yeah.
as you spend time on learning the human anatomy and the body, you're going to spend just as much time trying to figure out how to use technology to improve the health situation.
Yeah, yeah, yeah. So look, this is one that I always think of the metaverse, and I'm like, oh, geez. But so you outlined 23 use cases for customer experience in the metaverse economy. In a healthcare context, what might some of those look like for, say, patient engagement, like personalized virtual health journeys or 3D simulations for treatment education? Like, what are you thinking here?
So we're probably about 2 years away from this becoming a reality because we're moving from this form factor, which is a
Yeah,
phone, to this form factor, which is a glass. And
yeah,
what's
yeah.
happening with Meta, and if you look at what they're doing with glasses,
Yep,
that's going to drive everything because it's providing context, it's providing translation it's providing the ability to actually drill in, do commerce, make appointments, take
yep.
action. And I think that's really going to be the big piece. And so, whether as you're talking about health journeys or treatment education, or just a reminder that you need to take your medicine, I mean, these simple things are going to happen, and I think that's what's going to transform those types of patient experiences.
So 2 years away. I'm just going to mark my calendar. Honestly, well, maybe we'll reflect on that in an upcoming podcast. So, look, I think you and I are aligned here, and I really want to kind of pick your brain more and just see how aligned our thinking is on you critiquing traditional venture capital models, right? How can health tech startups secure funding that aligns with long-term community health outcomes rather than quick exits?
Yeah, so we've got a challenge with patient capital, and the question is in healthcare. you typically don't get the returns that you would be getting in other parts of the market. And what we've been doing
Yeah.
is we've been cherry picking, uh, let's say, loopholes either in reimbursement or loopholes in patient populations that you cover. And the biggest challenge is that you get short term gains, but then in the long run, it actually cheats the system. And so healthcare isn't one of those things where arbitrage is the answer. Healthcare is one of those things where you're really trying to address the root cause. And whatever that root cause is, right, whether it's a behavior element or whether it's an environmental element or whether it's at the genetic level, that's really what healthcare tech startups can start thinking about is, right, if you go to the core and if you make the investment for the core, that's what investors have to be focused on because the short term fixes are pretty much gone. I mean, let's
Yeah.
be honest, there's no money left in the provider space. There's no money left in the physician space. And for the first time since the passage of Medicaid and Medicare, there is no money left in the insurance space. And
Oh,
so
yeah.
we can't stop thinking short term. The only solutions left are going to have to be mid to long term in order to be able to make the turn, especially given the cost of healthcare in the US.
Yeah, I mean, look, just as one example, a lot of care delivery focused health tech startups are CPT code chasing, right? And when we look at the $4.6 trillion healthcare
Or,
economy,
or
right?
upcoding.
Or upcoding, thank you. Yes, you are correct. But every major stakeholder is facing massive headwinds, right? Medicare Advantage dollars are drying up. The CMS claims denial machine is happening, right? Pharmacy dollars are drying up, and Lord knows with the PBMs with preferred nation status, and the pharma codes are fighting, CMS rule max fair pricing, and they really haven't absorbed the full impact of the Inflation Reduction Act. So those are long term headwinds, right? And what you're saying essentially, and correct me if I'm wrong, is that these net new startups need to focus more on paradigm shifts, right? And that is going to require a patient dollar.
you know, Unless you're
Yeah.
rolling up ACOs. No, I'm just kidding.
Well, that's a private equity play. So as a jeez, you're right. So as a Cupertino Council member, how do you see local and federal policies influencing the adoption of AI in healthcare, especially with new FDA guidelines in 2025?
I mean, I think you're still going to see a lot of this policy driven at the state level, given that states
Yeah,
really do have the healthcare, but the funding is at the federal level. And so I think that's the challenge that you have to respect. I mean, at the local level, I mean, you can see certain impacts. For example, in our county, Santa Clara County,
yeah,
every physician is forced to wear masks between September and March because the county health directors has deemed it that way. Whether you think that's good or bad, or whether you should have a
yeah.
choice or not, I mean, that's really what you're going to see at the local level when certain jurisdictions say we have a specific problem. So it's not being driven at the federal. The FDA guidelines are going to have some impact, but ultimately, I think localities are going to make their choice.
That's a very interesting take. Thanks. So your
What do you think,
dynamic.
actually? Where do you see
Well,
it?
yeah, yeah. Look. I'll say this, right? Like I'm involved with as an advisor to some companies like Forward Slash, as an example, who are my last podcast guests. They're creating sustainable housing in their communities. They're procuring the master service agreements. They've got 4-payer contracts. They're looking at state Medicaid plans with high PMPM,
Yeah.
right? And they've been really able to reduce the cost, right? Because they're just dramatically lowering ED visits just by getting, people with serious mental illness and substance abuse disorder in sustainable housing. But to the point of keeping it local, they're just really creating the high tech stock 2 infrastructure to tie non-medical workers into Medicaid payments. But what surrounds that is community-based organizations that already know these communities and have already been delivering the care in these communities. So it's a hyper-local approach. And I think a lot of hard problems in healthcare are hyper-local. So I think we tend to align there.
I agree it's hyper local. Our challenge is our affordable housing units cost $800,000 a unit.
Yeah. I mean, at the same time, right, you have payers and health systems that invest in housing, right? So if you can offer them the 7% return on the real estate and a double bottom line of better health outcomes, it actually becomes, a sound business proposition. And it's a long-term solution, right? And you've got long-term stakeholder alignment there because you're actually benefiting the communities that you serve, right? And, not for anything, but if you get these people into sustainable housing, chances are that monthly household income will increase over a period of time. And I think that's probably the biggest KPI for community health.
I think
You
it's
know,
going to change. We'll see.
what do you think it's going to change to?
I think what you're going to have to see is more PPPs in place to pull that
Yeah.
off, right? So your REITs, in conjunction with the bondholders for your muni bonds for your healthcare facilities,
Yep.
along with what you're able to do on the private development side.
Yep.
So, I mean, we've got a situation right now, which I think is so acute. Is there's not enough beds in hospitals right now,
No, there are not.
not enough care. I mean, if you go to any hospital in America today, the overflow in the ERs is really ridiculous in most major metropolitan
Yep.
centers. So, and in where we are locally, as we're bringing that up, we have a situation where our county bailed out two private providers and
Yep.
basically now wants to tax everybody to pay for it because they can't make the numbers work. And these are healthcare institutions that were running in the red to begin with. And they had hoped that the private payers were going to stay in those facilities. And the problem is everyone that was in private care left as soon as it became a public hospital. So the cost shifting hit them harder than they would ever imagine.
Wow. Not to mention the fact that we have an aging out nursing and physician population, and we're going to be short 100,000 physicians in 1 decade,
Well,
right?
add the fact that concierge medicine is picking up, and instead of seeing an appointment one every 4 hours, you're now getting one every 2 hours. You just reduce your healthcare staffing by half.
That's true. That's true. So, a lot of positive and a lot of concern in the last,
We're,
120
we're,
seconds here, right?
we're gonna have to address this. I'm just saying that
Jeez.
that is
You know, like
huge.
the more we're talking, I'm like, oh my God, I'm just thinking about all these problems I want to say, but I really want to get to my next question. But man, there's a lot of things to work on, which is good, right? Because
Well,
that means there's opportunity.
yep.
Look, your dynamic leadership model emphasizes responsive and responsible leadership for digital transformation, right? How can health tech leaders apply this to navigate the rapid changes in AI and telehealth adoption in 2025?
Yeah. So in this model, responsive and responsible, you're basically saying, one model is more flexible, one model is more rigid, one model is more empathetic, one model is more disciplined, right?
Yeah,
And the challenges in healthcare, it really depends on what's being thrown at you right now.
yeah,
For telehealth and AI adoption, like telehealth is one of those things where you're giving people the flexibility, but there's some things that really can't be ascertained unless you're actually in person. And so it requires leaders to quickly determine what you're going to do in person, what you're going to do
yeah.
telehealth, and what trade offs you're going to make. We made trade offs because we weren't given a choice in the middle of the pandemic, but now we can actually sit down and rationally think about the choices. And this really takes some bold leadership where individuals and leaders in medical leaders make the decision as to this area is 500 miles out of our catchment area. What do we do to actually go out and deliver on care? Here's what the trade-offs are going to be, and we're okay with it. Here's something in a different scenario. It's someone that could be within a 5 mile, 10 mile radius. Here's how we're going to treat this differently. And you have to make the call. Is it the provider that makes the call ultimately? It's the physician that makes the call ultimately. But I think this is one of those models where you have to be dynamic and come back and assess things every 30 days to see is it working, is it not. AI is going to be the same, right? Did AI catch something or did AI miss something? Whether it's anything from a scan from radiology to a decision automation system that made a recommendation or that's checking for adverse events in a clinical trial, you're going to want to make sure that those checks are in place because 99% accuracy is not
Not good
acceptable
enough.
here.
No, no, not when lives are on the line, right? And the
Exactly.
lawsuits that cometh, I believe. And maybe this is not on the list. I'm sorry, but this is a question, maybe a little controversial, but who are the most bold, forward-thinking leaders in healthcare? I mean, is there any few leaders that my audience should follow just as some guiding principles, as people that are really thinking about these problems in a way that is truly bold?
Yeah, we convene our healthcare transformation summit once a year in
Yeah,
May, and we see a lot of those leaders. You get William Walters, who's now at Joint Commission. You got Aaron Meary at Jacksonville Baptist. You had Neil Gomes, one of the pioneers at Thomas
I know Neil.
Jefferson. Yep, and he's down in Florida or doing some other stuff. You have Joel Venko. I think he just left Bay State. I can't remember where he went to. Definitely, folks like that. I mean, there's quite a group of folks. Johnny Wu out at Centene Centurion Health. He's innovating what's going on with correctional medicine, which in itself sounds like a very niche specialty, but has such a huge impact given the number of prisons and prison healthcare. Actually, it's some of the best healthcare you can get today is in
Get
prisons.
out.
Yeah, as, as opposed to other places you would
That's
imagine. So, I mean, it's a wide range. I mean, you got um, you know, You got Raymond Lowe out at Alta Medical. He's doing some great stuff in terms of community health, population health management. But yeah, there's just a lot of folks, and a lot of them in our Healthcare Transformation Summit. I think they're doing some really cool stuff now at Emory in terms of the way they've done digital health. So I forgot who's in charge there. So, but just so many wonderful people in the space to definitely look at. So, oh, David
Awesome.
Giambruno, he's doing
Yep.
stuff at Tivity Healthcare, where Sarah Richardson was before as well. And basically, they've been able to drive down cost structures like people have never seen before. I mean, they were able to take hundreds of millions of healthcare costs out in real time in 9 months, instead of like things that would have taken 2 to 3 years.
Wow. Well, I'm sure going to follow these people, and now my audience can too. Thank you. That's a nice long list, and it's encouraging. Very encouraging. Look, as you know, burnout rates are high in healthcare, especially among care delivery workers. How should tech companies integrate mental health support into their workforce strategies, and what role can AI play here?
Yeah, so what AI can do, and if you're okay with AI watching or AI looking for signals, then it can make nudges and suggestions along the way for
Yeah,
people to take breaks, or for when mistakes look like they're being made, for folks to know when to take a break or ask for additional help or ask for a second opinion. We do see that. There was a very interesting comment made by some folks that graduated med school before 2000, and it was the fact that today's physicians did not go through the regiment of call schedules that happened before, where people did work 3 straight days or worked very brutal hours, and so therefore the individuals that are coming through today don't have the same toughness. Um, and it was an interesting statement,
hmm,
because what there is a general observation that today's healthcare workers are more lifestyle healthcare workers than committed. Um,
yeah,
I don't know if it's true. I think it's because we've taken more elements into place in terms of what it means to be well, in terms of the well-being. Maybe the older physicians and nurses and healthcare workers were more focused on just one area of their career. I think what we have now is a much more multifaceted um, set of workforce, where they're
for sure.
actually they appreciate a lot more different things in their life, including work-life balance, including
Yeah,
family, including other hobbies. And I think that's what we really need to look at. And so those burnout
yeah.
rates, the expectations of what is being designed by one generation versus the other generation, um, there's a big mismatch. And I think that's really what's driving these burnout rates.
Yeah, that's a really great
The
point.
model doesn't fit where people are today.
We've changed
Like
for sure.
2000 is the dividing line from what I can tell.
Interesting. Interesting. Makes a lot of sense. Look, your concept of authentic business emphasizes trust and transparency, which I'm a huge believer and fan of that. How can healthcare tech firms apply this to build patient trust in AI-driven solutions?
It's really the ability to do the audit trail and the ability to reverse. If you have the ability to handle reversibility, the ability to forget, you've got now delivered the ability to provide trust. Um, Customers and patients and physicians and the provider organizations and insurers, they all want to know that the system is learning, it's adapting, and it's not just making random and arbitrary decisions. And you want to understand why those decisions were made. So the veracity of the decision and the audit trail on the back end is so important in terms of allowing organizations to understand why a decision was made and if it actually had human feedback.
Seems very sensible and logical, right? Absolutely. Audit trail. As co-host of Disrupt TV, you've interviewed countless leaders. What's one healthcare tech trend that from those conversations that you think will define the next decade?
Well, I think the biggest one is, are we building to the Star Trek roadmap, or are we building to the Black Mirror roadmap? And I think we have to figure out
Jeez,
which one we're headed and which side you're on. Are you team Black Mirror or team Star Trek?
I'm Team
Um,
Star Trek. I think it sounds much better to me.
I think I'm team Star Trek too, but I think we need to learn from Black Mirror what not to do. And I
Yeah,
think that's really the big trend, is we are building to those roadmaps. And the good news is that, we can get to them. Having the patient doctor show up and be able to help you along the way. Some of the cool technologies that are available, like we're getting close to a tricorder. right? Um,
Yeah,
but we've definitely got universal translation capabilities, which is amazing,
yeah,
which definitely helps, especially when you have very mixed patient populations, like
for sure.
very different, diverse patient populations from all over.
Yeah, that makes a lot of sense. Okay, with AI being a cornerstone of health tech in 25, obviously, just looking at all the capital deployment and where it's gone this year, especially in venture and healthcare technology, what do you see as the most transformative AI application we're witnessing right now, like right today? And where do you see its limits?
Anything that can do translation for charts. Voice to text is saving physicians so much time. It's saving nurses so much time. Any frontline healthcare worker like can take advantage of voice in healthcare. I think that's what we're seeing immediately. Long term, I think it's the ability to bring suggestions and nudges that not only do two things. One, to make sure that everything that prevents an adverse reaction or adverse event is in place, and then everything
Yeah,
that we can do to actually simplify and reduce the time it takes from scheduling, filling out the next appointment, picking up a prescription, like all those things that waste a lot of time in people's lives in healthcare. If we can reduce that wait time with AI optimization, that's going to make a huge difference.
yeah, I agree,
Just the little
100%.
things, they all
It's
add up to hours, like
it's the little
days of
things.
people's lives,
Yeah.
like weeks of people's lives. So
Yes, for sure. Okay, so in Everybody Wants to Rule the World, which I read, you gave me a real understanding of the data-driven digital network. It was awesome, really great book. You discussed digital giants, right? And what role do you think companies like Amazon, Facebook, Google play in shaping healthcare technology over the next 5 years?
well, I think it ultimately comes down to trust. And the question is, do you trust Amazon with your data? Maybe. Do you trust Facebook with your data? Probably not. Do you
Nope.
trust Google with your data? Maybe. The
Mm,
one company everybody trusts with their data more than anyone else is
I don't know. You tell me.
Apple.
You know what? You're right, because we all have Apple products, right? And, they've really taken that privacy first angle. But let me ask you, I mean, how much really from the tech perspective are they differentiated privacy wise from these other ones?
The ability for the feds not to be able to get into a locked phone.
That's true.
Um,
Well, they decrypt it though, right? Eventually they get in, don't they?
eventually they can figure out so long you don't use anything in the cloud, right? So if you're not in the
Yeah.
cloud, iCloud for any of your devices, you're still
Everybody's
protected.
an iCloud.
I'm not in iCloud.
You're not?
No, I put my data in iCloud.
This
I'm
is a
doing
great,
stuff in
this is a
iCloud.
really good thing to ponder, folks, but anyway, keep going. Sorry.
But think about that. There's 3 billion parameters here and an AI chip like no tomorrow. What does that mean? I can decentralize AI. And so what we're going to see is this push for AI at the edges, and
Yeah, yeah,
that's
yeah.
going to create a huge opportunity for Apple and other folks that subscribe to that approach in the ecosystem.
Very cool. Very cool. Very good, interesting insight there. Okay, so you've spoken about, and I've seen this a lot, over the past couple years. I just what I'm really talking about is the gig economy and its rise. Right? How can health tech firms leverage independent talent to address talent shortages in roles like data engineering, as an example?
So I think we're going to see more and more fractional
I
roles
think so too. I do.
and that plus the fact that we have companies. So there's a piece that we've been spending a lot of time called exponential efficiency. We see a whole set of AI exponentials that are entering the market, right? And so it ranges from AI Luddites to AI aware to
Mm.
AI enabled to AI native to AI exponentials.
Yeah.
We see 10-person companies doing 200 million in revenue. We
Wow.
see 100-person services firms that could take out an Accenture in the future at 1 billion in
Wow.
revenue, and be able to get to 1,000, right? This is the scale we're talking about. You can go to a website, it's wild. It's called tinyteams.xyz, and you'll see these tiny teams that are having huge impact. That's just the beginning of this. So if something that used to take 10 weeks can be done in a day, that's the scale we're looking at. And so add the gig economy, add the fact like data engineering roles are going to be fractional. We're going to see a lot of capability that's going to be delivered not only with AI but also with fractional roles.
Yeah, I mean, like, look, this is just like an ad lib from our questions, but I mean, you look at like these engineers that are like working for 5 different Y Combinator companies, and you know
Yep.
what I mean? But like when you look at the return on invested capital with respect to digital health, right? The $60 billion that's gone in over the past decade, just by proxy of some of these companies migrating to a C round, health systems. You have a health tech company focused on health systems. 5% of those companies go to a C round. life sciences 10%, payer 16%. But like de-risking, your equity involvement, if you're a really high performer, it almost makes sense if you can do 3 or 4 jobs at once. But it almost kind of relinquishes or shifts the paradigm of control too. So I think like that's an interesting insight that I think I'm seeing. What about you?
No, I would add to that. I think
All
the
right.
point being is there's going to be less money required to create a startup, which means there's more opportunities for more startups.
Yeah.
I think it's important for not to crowd the space. I think the VCs have done a good job. Well, probably done too good of a job managing the number of startups in a category by not investing in deals and
Yeah.
syndicating deals so that they pretty much have chosen the 3 to 4 winners in each category. But I think by pushing this out even further, where you don't even need VC money to be able to pull this off, you just need very light capital and a lot of private investors. That's going to create a boom in healthcare innovation that we haven't seen before. Because right now it's very expensive and very gated.
So you basically just said there's going to be a shift in the funding model,
There's a
right? Or
massive shift in the funding money. So there's this individual
this is interesting.
that was
Very
thinking
interesting.
about giving us money to create this hypothetical organization called Constellation Ventures. And let's say they give us 100 million.
Yeah.
And we raised another 100 million because fund economics mean I need 2% to hire a team, a staff, a set
Yeah.
of folks, right? So I need about 2 million in payroll, 3 million payroll to make it work. Fine. I don't know where I could invest 100 to 200 million today because the startups I want to invest don't really want anybody on their cap table. And the
Yeah.
startups that want my money are like, I'd say a high percentage that they're dogs. They're not going to work,
Yep.
right? And so as an investor, you're probably going to have to return a lot of your capital back because you can't find the right balance. And with these AI exponentials
Wow.
popping up, the VC business is like in a lot of trouble. And with interest rates still high, we haven't seen a 200 basis drop in the federal interest rates. Like it's very hard to make these deals flow. So we don't have a lot of
Yeah.
IPOs on the back end to justify a lot of the spend for the return. So we're in this really weird situation where VCs are here, Ps are left holding the bag with a lot of these acquisitions, and we literally need interest rates to drop if you want to see an IPO boom.
Well, 2% inflation. Let's hope that we get a rate cut soon here. It's a little bit past due. I don't
We're
know if
so
you've,
late; it's not even
aren't we?
funny.
It's like ridiculous. I mean, and let's just leave it at
Maybe
that.
some data we're missing. Let's give them the benefit of the
I don't. Oh yeah, sure. Okay.
doubt.
Look, looking at futuristic perspective, right? With advancements in precision medicine, do you predict, which ones are going to dominate healthcare by 2030, and what talent will be needed to support them? I thought, I was listening to the All In podcast and David Freeberg talking about, some of the advancements with large language models and Yamanaka factors as an example, right? Like, and the idea that we might actually have longevity based medicine that's commercially available in a decade. Like, what are going to be those big things 10 years from now?
10 years from now, it's going to be quantum and the ability of determining outcomes and where your genomics matches a certain outcome that's desired. And basically, they're going to give you a thumbs up or thumbs down saying, yeah, you don't qualify for that treatment because your genomics don't match, right?
Yeah, yeah,
The other way is, hey, given the fact that 70% of the population has this has this DNA footprint, here's really what we should be focusing on. It will also change the prioritization of healthcare funding and really in terms of the biomedical research. So we want to drive down the cost of molecule to market from 10 years down to 5 years, down to 3. And we also want to take it down from $1 billion to 100 million. That's really what the future
yeah.
is going to look like.
Yeah, it's crazy though. Unfortunately, we don't have like the testing infrastructure and the reimbursement infrastructure to support any of that right now, and it is a mess.
One of the interesting things, we had a country, a hospital in a certain country come and visit, and we gave them some advice. We said, if you want to be the dominant player in your region, given the fact that you are kind of a monarchy, you can give your subjects,
Single
and
payer.
this not single payer, not there. I'm still a free market guy,
Okay.
but here's why. So the the challenge in every organization is the thing that our friend Richie at Wario mentioned is the fact that
Yeah, yeah,
individuals don't own their healthcare data. So
yeah,
if
yeah,
you're a monarchy, give them the right to their data, make it a property, right? That
yeah,
they own their genomics, their DNA, and all that information. So kudos to Richie here. If
yeah,
you
for
do
sure.
that, you will attract amazing set of physicians who want to do research on digital health data that you're able to provide because now you have the rights established. That data set will then drive the best scientists to come over, which means the pharmaceuticals will come because you've got the ability to actually provide the fidelity and the longitudinal records that are required for this type of health research.
Well, if all that happens, talk about first mover advantage, man. I mean, God, that
I
would
hope
be
they do
huge.
it. I hope this country does that. So,
That would be a good move. I think. I think we should be paying
but
attention to
we
that
should be doing
here.
that. Let's just
Yeah,
start there. I mean,
it's an asset class. Okay, so with consumers concerned about AI privacy, and we talked about Apple just a second ago, but what ethical framework should health tech companies adopt to ensure trust and compliance?
first of all, the individual needs to own their healthcare record. We got to stop this thing
Yeah,
where one or two vendors think they can hoard all the records, then charge people $250,000 for a button, $500,000 for an API access to something that really belongs to the individual. The second thing that actually has to happen is, um, even if we own our own healthcare record, we have to understand what's in it. It's almost like a credit report gone wrong. And you've got to be able to see it on a regular basis. You've got to be able to have an easy place to manage that. Who pays for that? Who sets that up? It's most likely the insurer that's probably going to want to set that up because they're going to do it in their format. But I think the ethical frameworks that are also behind that is one last thing is, that shouldn't be used against you to deny coverage. And I think
no, yeah,
really the piece that most people are concerned about. We've all seen the movie Gattaca, right?
yeah,
Where your DNA and your genomics dictate what job you have and how you're being treated and where you're going. I think at the first basic level, we have to make sure we protect against that.
I agree. All right, so your book, Disrupting Digital Businesses, discusses leadership shifts, right? How should health tech leaders evolve to manage the pace of change in 2025?
Number one place. We've been spending a lot of time on board research. One of our analysts, Esteban Kolsky, we call him the chief distiller. He's taking 3,000 signals in AI, doing human distillation, and helping boards become more tech savvy. I hate to say this, a lot of healthcare organizations have boards that are from the last century. And what
Yeah,
we really need to do, and it's not even just the last decade, the last century. And it's not because the individuals are older, it's just the individuals don't have a connection to what the speed and what the scale is that we're operating at. And we're operating at the wrong scale in most organizations. That level of change is not a 30% improvement, it's a 10x improvement. And it's
yeah,
going to be 100x and 1,000x over time. And we have to understand the impact of what that change means for an organization. And that's really where we're starting to do a lot of board education. And so we have a product called The Board that basically helps organizations and CEOs who want to help their board members, in a way that helps them learn and get up to speed. They can get a monthly update, but more importantly, they can have the time in private to learn about a technology, ask the questions they need to get up to speed. And we think that is very important because that then gives CEOs the ability to move quickly enough. But we also have a case where CEOs aren't moving fast enough, and people on the board are expecting faster movement of the
mm,
management teams. And the same thing is being done there, helping executive leaders understand what they can do within their budgets and what's possible and not possible.
wow, great. Well, look, I'm all out of questions, and
A
wow, I
lot of
mean,
questions, dude.
thank you. And I've been preparing for this for a while because I've been really excited about the opportunity. I mean, you're just such a passionate guy, and you're so bright. And I've been following you for
I,
quite some time. So just so thankful for you to join me today here. I know that my audience is going to get a lot out of this. I sure did, and you've left me with more questions than answers.
until next time, dude.
Until next time, great
Hey,
meeting you,
thanks a
Ray.
lot.